Hi everyone, welcome back to Lymphedema Care Management. Today we're going to be tackling a common confusion. What's the difference between lymphedema and lipedema? They sound very similar, but they're very different conditions that need different type of care. Lymphedema happens when the lymphatic system doesn't drain properly. So fluid builds up. It can be caused by cancer treatment, surgery, chronic venous insufficiency, trauma, obesity, and even from birth. It usually affects one arm or a leg, often unevenly, asymmetrical. But in the early stages, it can leave a dent on your skin that's called pitting edema. Over time, the skin can thicken and harden, but the management will be focusing on manual lymphatic drainage, compression, skin care, education, and decongestive exercises. Now, lipedema is a lot different. It's a chronic adipose or fatty tissue disorder. It is not lymphatic failure. It most only affects women and shows up at puberty, pregnancy, or menopause. It causes symmetrical fatty tissue buildup in the legs and sometimes the arms, but usually the feet and the hands are spared. The tissue can be tender, bruised. No matter how much you have a diet or exercise, the fatty tissue disorder doesn't go away. Compression can help, but specialized care may be needed, such as liposuction. So let's do a quick comparison. Lymphedema is usually one limb and it's going to be larger than the other. Lipedema is symmetrical. Both legs are affected, but they look alike. Lymphedema is fluid related. Lipedema is fatty tissue disorder related. Lymphedema swelling is firm. Lipedema tissue is tender and bruises easily. Lymphedema usually affects the feet or the hands. Lipedema spares them. So getting the right diagnosis is key because the care is very different. If you or your patients notice persistent swelling or painful symmetrical fatty deposits, talk with a trained clinician. And also keep in mind that with lipedema, it can eventually over time lead to a lymphatic problem. So thank you for listening. Make sure you share this with others as we want to make sure we get to clinicians, patients, students, and caregivers. Thank you very much and have a great day.